Finally, let's take a look at the treatment of tuberculosis. To treat the patients with tuberculosis, we need to consider a lot of things, like what drug we should use, like what regimens we should choose, and we need to monitor the treatment response and drug toxicity. What if the patient have treatment failure or relapsing TB? And we also need to consider drug-resistant TB and those TB patients with HIV infection. With limited time, we're going to just look at the first-line drugs. They are isoniazid, rifampin, pyrazinamide, ethambutol, and streptomycin. For isoniazid, it can be shot as INH or H. For rifampin, it can be shot as RFP or R. For pyrazinamide, it can be BZA or just Z. For ethambutol, it can be EMB or just E. For streptomycin, it can be shot as SM or just S. There are a lot of things about these drugs, but with limited time, we are gonna know more about them. If you want to know more about them, these drugs, please read the textbook. To treat tuberculosis, we have to face a challenging question, that is MDR or multiple drug-resistant TB. This is a form of disease caused by bacilli resistant to at least isoniazid and rifampin. Up to 60% of all MDR TB cases occur in China, India, Russia Federation, Pakistan, and Ukraine. It is a very, very challenging problem for doctors in these countries. What about XDR-TB? XDR-TB is actually based on MDR-TB. It means these typical bacilli, they are not just resistant to rifampin and isoniazid. They are also resistant to the most powerful second-line anti-TB drugs. They are fluoroquinolones and at least one of the injectable drugs, amikacin, kanamycin, or capreomycin. It is estimated that up to 10% of MDR-TB may actually be XDR-TB. Even these data are still maybe underdiagnosed. This is the regimen recommended by WHO for anti-tuberculosis treatment. For different types of infection, like new smear or culture, or smear negative cases, or even patient with pregnancy, or patient with XDR or MDR, we have different types of regimens for them. We are not going to go through all the details here, but please read them yourself. Even with proper treatment, TB caused by drug-susceptible strains can be cured in vast majority of cases. But if untreated, the disease may be fatal within 5 years in up to half of cases. Some of patients may develop chronic fibrosis disease, especially those who are not properly treated. And drug-resistant TB may also develop in these patients. MDR, or even XDR. So TB is a worldwide problem, especially in undeveloped and developing countries. Thank you for your time.